Hey y'all, it's Zoe, your nutrition peer, back here at Nutrition Prep Notes to help you study for the CNS exam. In today's prep note, we're going to be talking about scope of practice and how it is your secret weapon to passing the CNS exam. Stay tuned. Okay, y'all, so I meant to tell you in the intro that this episode will be pretty rich, and so I really recommend that you grab a notepad and a pen, a writing utensil of your choice, and take notes for this episode because I'm going to be going over the scope of practice with you, how to use it to your advantage when you're studying for the CNS exam. And then we're going to be having a little bit of exam content review throughout. So you may want to take note of some terms and things like that that come up that you may want to study further. So without further ado, we're going to talk about how the scope of practice is your secret weapon to pass the CNS exam. So CNSs focus on identifying and addressing root causes of medical conditions and diseases and moving patients toward optimal health. And so this is an important lens to have as you're studying for the exam. Scope of practice is domain 8, and it's the practice management section, and it's subtopic 2. Now, while domain 8 is only worth about 6%, weighted 6% on the content outline, don't let this make you downplay the importance of the scope of practice, because while it is listed only in this section, it is important to keep in view as you are taking the exam. The CNS exam is not only assessing your nutrition knowledge base, but it is also assessing your ability to be able to operate within your scope of practice in order to carry out what is talked about in the scope of practice, which is the personalized nutrition care model. So you have your nutrition knowledge and you have your scope of practice, which determines how much you're allowed to legally do and how you're legally able to serve your clients or your patients based on where you live. And so you have your scope, and then operating within that scope, how are you able to carry out what the BCNS determines as the personalized nutrition care model? Scope of practice highlights. So your CNS scope of practice is outlined in the BCNS scope of practice, and it does not necessarily determine your legal scope of practice. Well, what do I mean by that? Your legal scope of practice is determined really by the state that you live in. And so your individual scope of practice is based on this document here. And then it's also based on where you live. And where you live will determine how much you can legally do as it relates to performing nutrition care services for your clients or patients, whether or not you can perform medical nutrition therapy or whether you may have to stick more to just being able to provide nutrition education for your clients. Your ability to give advice and then your ability to recommend supplements and things like that are impacted by the state that you live in. So keep these things in mind as you're preparing to certify, and then also make sure you have this in mind as you're going into your exam, making sure that you understand, okay, what's going to determine the individual CNS's scope of practice. So we talked about the BCNS scope of practice, which gives us the broad guidelines, and then your federal and state laws, rules, and regulations. And then 3, your employment guidelines. So your individual workplace and faculty guidelines based on the institution that you're working out of. And then number 4, what will determine your individual scope of practice is any additional training or education credentials and certificates that you have. So for example, for those of you who may be medical professionals as well, you'll be able to add the additional layer of possibly providing a medical diagnosis or possibly suggesting a form of medical treatment in addition to nutrition care services to your clients. But this is determined based on your own individual level of training and based on your own individual level of credentials that you hold. So it just depends for each person, but the individual scope of practice is based on these 4 pillars. So for the purpose of the exam, however, you are a certified nutrition specialist candidate, and you want to have your CNS cap on as you're taking the exam. And so the exam is not specific to you. And, I know that all of you know this. I'm just reiterating this point. The exam is not specific to you, even if you have additional training and certifications and things like that. For the purpose of the exam, you want to study like a CNS, and then you want to take the exam like a CNS as well. It is also important, what they pointed out in the scope of practice, is to know when a client needs to be referred. So let's talk about an example case. So we have a 32-year-old female working with a CNS. So let's say that you're the CNS, right? So 32-year-old female working with you for 3 months because of hormone imbalance and weight gain, fatigue, poor diet, and lifestyle routines. And she also has infrequent headaches. She has worked with another practitioner in prior times, and it was identified that she had an MTHFR A1298C polymorphism. Since beginning her nutrition counseling, she has had improved labs, so baselines were taken, but her B12 labs, HSCRP, homocysteine, vitamin D, thyroid panels, which include TSH, free T3, T4, reverse T3, and thyroid antibodies. Her 6 hormone panels were assessed: estrogen, progesterone, testosterone, DHEA. Stool labs were assessed, and it has been reported at the end of 3 months of her working with you that she had significantly improved levels of lactobacilli and bifidobacterium and Akkermansia municiphala. And the client reports that she is more productive and has more energy throughout the day. The nutrition protocol that you put her on, for example, is a higher protein, lower carbohydrate diet with organic whole foods and grass-fed, pasture-raised, and wild-caught meats, polyphenol-rich foods like pomegranates, cranberries, blueberries, extra virgin olive oil, etc. Avoidance of synthetic vitamin B9 as folic acid, and avoidance of chocolate, because it was discovered during her time of working with you that she is also tyramine sensitive. Supplements that you recommended included a multivitamin and mineral complex, as well as folinic acid supplementation, magnesium, vitamin D3K2, a probiotic. Her lifestyle recommendations included 8 hours plus of sleep, which she has been reportedly getting most days of the week, improved familial support in relationships, she has reported, as well as she is exercising 3 to 5 days per week. Now, at the end of the 3-month checkup, the CNS notes that while the client has shown an overall improvement in depression-related markers, clinically, her speech and disposition at the last couple of follow-ups still seems low. So the client did not initially disclose, and this is something you later discovered after having several sessions with her, that she actually has a childhood history of mental and emotional trauma. So what's next for this client? She's reached the end of her 3 months with you. She wants to continue her nutrition consults because she likes the results that she's getting. However, you're hearing her language for the past few sessions, and you're concerned that it may be some deeper issues that she's going through. And so you're trying to determine, what should you do next? Will you renew a contract with this client? Is it time to refer this client? What are you thinking? And so this is a little quiz. So if you had to choose, what would be the best next step for this client in particular? A, medical referral for depression. B, provide licensed clinical counselor referral and continue working with client. C, increase the client's Akkermansia supplement dose. Or D, tell the client to get happy and gratitude journal daily. What do you think would be the best answer? And I'm going to give you guys a second to answer. You actually can just pause it and then choose your answer and then unpause the video and I'll give you the right answer. And then if you don't agree with my answer, leave me a comment and defend your reason as to why you chose a different answer. Okay, A is incorrect because what you're really hearing in session is the client pretty much talk about, you just hear her language. And it kind of seems like maybe she could benefit from an outside perspective, maybe on her situation where she is now, and maybe some reframing help. However, because you were made aware that she has a history of childhood mental and emotional trauma, the correct answer is B. And so, because you were made aware of that, you may be more, is a medical referral really the most appropriate next course of action? I would say no, especially because a lot of the clinical markers for depression have mostly resolved as it relates to what is being reported clinically. And so it could be possible that your client just may need additional support reframing and really addressing some of those childhood wounds, possibly. Just because some of her language was concerning to you, a referral is definitely the best course of action, in my opinion, moving forward for her, as well as her continuing to work with you to refine some of the things that still are lacking in her routine. The reason that C is not the correct answer is because just increasing the amount of Akkermansia that she's taking, while the Akkermansia population in the gut has been shown to help be protective against depressive markers and improve mood regulation, that doesn't mean that just increasing someone's supplemental dose of that is going to resolve the conflict that may be going on in their mind and in their emotions. So that's something that really needs to be addressed by a professional who is licensed and trained. And since we are not, unless you are, if that's another certification that you have, then there's that. We're not therapists, so it's really out of our scope to go deep into that realm. And so that's why a referral would be appropriate. And then D, tell the client to get happy and gratitude journal daily. This is just not appropriate to say to any client. Really, just in this manner, it's just a different way that maybe you could frame it. But in the case of this client here that we've discussed, telling them just to get happy and gratitude journal is really not going to address some of those deeper mental and emotional, maybe conflict areas that they are experiencing. And so that's why a qualified professional referral would be highly recommended in this situation. So again, if you don't agree with my answer or explanations, leave me a comment and defend your reason why. So the next thing I want to discuss with you all is this personalized nutrition care model. So we said that the CNS exam, yes, it's assessing your nutrition knowledge, but it's also assessing your ability to be able to operate within your scope to do what? Carry out the personalized nutrition care model. How do we know that's what the exam is assessing? Because many of the elements that are on your content outline are also mentioned within our scope of practice. And so that's why it would be good to be knowledgeable of these things. And so we want to take a closer look at the personalized nutrition care model. So what is this? The personalized nutrition care model consists of the nutrition care process that a certified nutrition specialist uses to help their clients resolve and deal with their nutrition related conditions. And so this model is composed of assessment, quantitative and qualitative inputs such as diet, behavior, symptoms, genomics, and biochemistry, Number 2, interpretation in light of the personalized nutrition science and data. Number 3, intervention, personalized nutrition guidance and therapeutics. And then number 4, monitoring and evaluation. And so that's the ongoing monitoring and feedback that we engage in order to modify the recommendations we give to our clients, especially as the markers improve and as different things in their life improve as they're making advancements towards optimal health. And so what you see here in this model are arrows that show that it go in a circle because it's a continuous process throughout the time of your work with clients. So we're going to talk about assessment. And so as it relates to conducting assessments, you all, nutrition assessment, which is actually a whole section on our exam, which is domain number 4. Fundamental components of the assessment section are to collect quantitative and qualitative information to assess your client's personal health status, your client or patient's personal health status. And so, what is quantitative information again? I remember, I don't know if you all had to take a nutrition research course, but I did. So I have a whole book on that. Some of you may or may not have had to take a course like that. So I'm giving you a little bit of the research review here. So the term quantitative as it relates to the data that we're going to be looking at as nutritionists is objective measurable information used to determine client or patient's nutritional status. So think quantitative, think quantity. You're looking more at numbers and things like that. So what would count as quantitative data that you would want to look at for your client or your patient? It would be nutrition intake data. You would want to see maybe calories, macronutrients, or micronutrients being consumed on a daily to weekly basis. You may want to see their anthropometric measurements, which most often we do, right? Height, weight, BMI, even head circumference. And what anthropometric measurements refer to really are just the measurements of the human body. So that's a way to think of that. And then biochemical markers, which can be found through analyzing lab results. And then we have our qualitative data. And this is the way that I like to remember what the definition of qualitative means. It gives the quality insight to what can't be properly expressed explicitly through numbers. So it gives quality insight to what can't be properly expressed explicitly through numbers. So qualitative data focuses on the why, the how, and the what. It can give insight on dietary composition and eating behavior. It looks at how culture and personal beliefs shape eating habits. And it helps to capture the information through open-ended surveys and interviews where clients can elaborate more on their specific situation. It also includes notes on observation. And so assessment is step 1 in helping you to determine your nutrition diagnosis, which we'll talk about next. Step 2 of the personalized nutrition care model is interpretation. And so based on the information that you gathered in the assessment phase, this is going to help you to be able to determine a nutrition diagnosis. So the first expression of interpretation of nutrition data, or all the information that you gathered during the assessment phase, is through formulating a nutrition diagnosis. What is a nutrition diagnosis? A nutrition diagnosis is a diagnosis that you determine as the nutrition professional based on the qualitative and quantitative information you have collected on your client. So let's walk through this. For example, we have a 45-year-old male, medical diagnosis, type 2 diabetes. Okay. So as a nutrition professional, we do not diagnose our clients or our patients with diabetes or any medical condition. What we do is we assess the state of their nutritional health. And so let's look at the information we have on this individual. We have a lipid panel that reports triglycerides 150 milligrams per deciliter, HDL 37 milligrams per deciliter. The triglyceride to HDL ratio is 4.05. We have a report of an HbA1c of 6.6% for this client. From a food frequency questionnaire, we're able to determine that there are poor meal planning habits. And based on this information, we come to the conclusion and formulate a nutrition diagnosis of overconsumption of ultra-processed carbohydrates. Now, the difference between a nutrition diagnosis and a medical diagnosis is that a medical diagnosis will not change as long as the condition is still present. But a nutrition diagnosis can change, especially as we continue to work with our clients and things begin to resolve, biomarkers come back changed, things are improving. Well, then the nutrition diagnosis can change. And so it is more readily able to change as opposed to medical diagnosis. Whether or not you call your clients or patients a client or a patient is determined based on the laws and the regulatory structure of where you live at, and then your telehealth practices and laws as well. So keep these things in mind. The scope of practice uses these terms interchangeably, but I also use them interchangeably throughout this presentation as well. And so third component of the personalized nutrition care model is intervention. And so this is where the rubber meets the road. So we've assessed our client. We have interpreted the data that we collected and formulated a nutrition diagnosis. And so now we prepare an intervention plan or a medical nutrition therapy protocol. And so at this step, we're asking ourselves, okay, what's the MNT protocol for our client? So assessment plus interpretation leads to intervention. And so considering all the information we've gathered thus far to help us formulate an evidence-based MNT protocol for our client or group of clients, let's keep in mind the goals of MNT. And again, I'm summarizing a lot of what is written in the scope of practice to give you an overview and to give you a talk through, especially from the perspective of someone who's already taken the exam. And the goal of MNT, as defined by the scope of practice, is optimizing health, preventing disease, effectively managing chronic health issues or conditions, and addressing both the symptoms and their underlying root causes. And so when you really kind of break that down, that's something to pay attention to. And these are skills. And even though these are the goals of MNT, think about how you would be assessed on the exam to determine whether or not you understand the purpose of MNT protocols. And so where do we start our protocol? So based on the client's readiness and top health goals or objectives. One of the things that I got health coach training. And so one of the things that they taught us in health coach training is that people are going to do what they want to do. And so even though there may be something really pressing and a very important medical issue that people may be facing, if they're not motivated and really convinced that it is a big deal, then they're probably not going to move or act on it. If they don't feel like it's very important, if they're ambivalent toward the health changes and modifications that they need to make, then they're not going to make the change. And so, depending on a lot of times how you came in contact with this client, if they were a referral, if they found you on their own, if they were just referred by their insurance company and their doctor, their level of actualization and their level of self-efficacy may be different. And so when you're coming up with a protocol, you really have to look at the readiness of the client. Are they really willing to make a change? And then based on this, plus whatever the health objective is, then you determine how to go about implementing this intervention and how you would suggest it be implemented in their lives, right? And so all of this is based on conversation. And so we also have to consider the cultural and the religious and the dietary preferences of our clients as we're coming up with interventions so that they align with their own personal belief system. And then we're also looking at nutrient, and drug nutrient interactions potentially here in case some of your clients may be on medications or they're already taking multiple supplements. So we have to dive deeper here. The scope of practice outlines this, but your content outline also reflects this as well, particularly making sure that you know your nutrient interactions, your nutrient drug interactions, and then understanding the role of motivational interviewing, and then also being familiar with major religious and cultural dietary laws and things like that. And I actually have a separate training on this, which I probably will put in the free resources membership, y'all, just because it has handouts associated with it. So we go over the motivational interviewing, and we also talk about religious dietary laws as well. So it's a really good review, and it helps to cover 2 out of the 99 subtopics for you on there. So definitely check that out. And then number 4, for our final component of the personalized nutrition care model, we have monitoring and evaluation. I have on here written, keeping the loop in sync. So you're making adjustments and monitoring quantitative and qualitative data about your client, and you're making updates to their MNT protocol as you meet with them. And the hope is that they're progressing and that they're getting better and better, as they're working with you and as they're staying motivated to continue to make the health behavior changes that they need to make. And so that is pretty much it for the scope of practice review today, y'all. Keep in mind that your CNS exam is not only assessing your nutrition knowledge base. Do you know the content? Have you memorized the things that you have to memorize? Do you know how to take the principles of nutrition and then apply them to harder nutrition concepts? And then do you know how to operate within your scope? And do you know how to carry out the personalized nutrition care model in practice? What does that look like? And so keep those things in mind. And then I have your checklist here at the end. And the checklist for this video is number 1, to read and reread the scope of practice. Make sure you have a good understanding of this. I really recommend that you print it out and keep it beside you as you're studying, just to help you stay on track and to keep in mind, what's really important for you to know moving forward. In the CNS exam, I also recommend that you keep your content outline beside you as well as you're studying, just so that you're staying focused on the content that you need to know. The scope of practice is really important, y'all, and I really believe that if you frame your study through the scope, it's going to make your approach to this exam so much easier. It truly helped me. I printed out the scope of practice, had my content outline alongside me as I studied for this exam within 4 months, and I was able to pass the exam. So it really helps. Make sure you understand the scope, use the scope, practice the scope, and you'll be setting yourself up for great success on the exam. So that's number 1. And then number 2, sign up for the free resources membership on my website and grab the free MTHFR fact sheet. That's a free review tool for you to help you review that SNP. And if you want my personal blueprint to studying for the CNS exam, you can grab that course on my website as well. And I take you through a list of all the resources I use to study for the exam. And it is a short resource list to help you stay focused. And the whole point of the course is to help you strategize and prepare well for the exam. So definitely check that out, y'all. And I'll be back here with another prep note next time. Take care.